It's a pleasure to see you all here in the hall today, and for those that are watching this on live stream or will subsequently watch it on YouTube or all of the other technologic marvels by which we communicate today. I'm Sam Hoggard, the Chancellor, and it's an absolute delight to welcome you all to the 10th Annual Chancellor's Leadership Forum on Diversity and Inclusion. This is an important event for my leadership team each year because it gives us an opportunity to unequivocally and enthusiastically reaffirm our support and appreciation for all members of our diverse community. We are together committed to cultivating a community where everyone from all backgrounds has the right to work and study in an inclusive environment where they can reach their full potential. We are committed to defending the free flow of students, scientists, scholars and staff to our university to continue their investment and our investment in science, biomedical research, healthcare and education. We are, after all, a nation of immigrants, including myself, and we all know that as a global community, all of us contribute to the knowledge that ultimately benefits the world. The recent executive orders relating to immigration affect individuals in every corner of our campus and along with their family members here and abroad. Moreover, threats to significantly scale back funding for research and potentially healthcare are of paramount concern to our community. I am working with my colleagues across the UC system and the nation to educate policymakers about the potential impact of these proposals on our institutions and our ability to provide support to our community now and into the future. Last Saturday, as an example, I was heartened to see hundreds of UCSF faculty, staff, students and supporters join the local life science community to stand up for diversity and inclusion in advancing scientific discovery. It was a great event we labelled Stand Up for Science on the Mission Bay campus. As Chancellor, I have made advancing diversity and inclusion, including addressing health disparities, one of my top priorities, because diversity is, after all, integral to UCSF's excellence. We do not use the word excellence lightly. Excellence is written into UCSF's pride values to remind us that we must strive for the utmost professionalism, to be respectful, act with integrity, and appreciate the diversity of our colleagues, students, and patients. As a flagship institution and second largest employer in San Francisco, I and all of UCSF fully acknowledge the significance and symbolism of the word pride to the LGBTQI community. We will continue to ensure that this community, particularly transgender students, faculty, and staff, have all of the protections that are afforded to the rest of us. Now, in a few minutes, Vice-Chancellor Renee Navarro will give you an update on the progress we've made this past year. I'd like to just highlight two efforts that are making a difference. As our campus works to improve healthcare for the underserved, we are driven to ensure that the next generation of practitioners reflect the diversity of the patients we serve. I'm particularly excited about the Differences Matter initiative, a 5-year, multifaceted project led by some of our most respected faculty and administrators, which aims to make UCSF the most diverse, equitable, and inclusive academic medical center in the country. Last fall, the Office of Diversity and Outreach launched the Diversity and Inclusion Certificate Program, a training opportunity exclusively for staff members. So far, 56 people have participated at Parnassus and Zuckerberg San Francisco General Hospital. The call to apply for the fall program will soon be out on the ODO website, and I encourage the staff to apply. Our summer research training program, run by the Graduate Division and now in its 30th year, brings college students from underrepresented backgrounds to UCSF. These students work alongside UCSF scientists who can inspire them and advance their careers. So in closing, I want to thank Vice Chancellor Renee Navarro and her team for organising this important forum this afternoon and for all the work that they do to foster diversity and inclusion at UCSF day in and day out. We all know that we have more work to do, and that means all of us have more work to do. The work to remove barriers and be allies, to foster equity and unity, and to speak up and stand up for the principles and values is our shared responsibility. We are stronger together, united as one UCSF. So welcome to the Diversity Forum for this year, and please welcome Renee Navarro.
Thank you, Chancellor Haga. Thank you very much. Thank you for all of you, to all of you for being here, to the Chancellor's Executive Leadership Group. I thank you as well for participating in our 10th annual forum. Your leadership and your accountability around these issues are critical, so it's great to partner with you as we move the university forward. I wanted to, of course, thank my team. The ODO team does a fantastic job year after year, and so I thank you so much for your work in making this happen for us today. This marks our 10th annual forum, and this is very significant. It's significant because, one, it affirms the fact that UCSF has a long history of commitment, dating many decades ago, but for the last 10 years, having our leadership here, being accountable, talking about what we're doing, showing you what we've accomplished, and talking about where we need to continue to move forward. So that is significant. It's also significant because it's so necessary, especially now. I think it is critical that we stand up and that we speak up as leaders to really reaffirm what our values are and what our commitments are. You received with your program our value statement and our principles of community. We want us to live these principles and values on a daily basis. The national rhetoric, the executive actions that have been taken, the proposed changes to healthcare, to research, funding, really threaten us, threaten our core mission. As an African American woman, I feel threatened. As a doctor, as an individual, I feel threatened by much of what I've seen and heard over the course of the last several months. And I fear moving in the wrong direction for our country. And I know that I have privileges, and so I worry about those who are the most vulnerable and marginalized among us, and worry that our civil rights gains are at risk currently. So we're here today to affirm and remain steadfast in our commitment and our goal for a more diverse, equitable, and inclusive UCSF, California, and nation. This work is essential to our quest for excellence. I always start off by reminding us of our definition of diversity. Diversity is about all of us. It are all the qualities and characteristics that we bring with us and how we show up. And I have to remind us, because we often focus our conversations on underrepresented groups and those that we're trying to fully engage, but we really are all in this together, and it really is going to require all of us working together in order to make significant gains. Inclusion is how we actually leverage that diversity to really move issues forward. The Office of Diversity and Outreach, we work on a daily basis. We're focused on building, on nurturing, on engaging others to facilitate the full inclusion of all members of our campus community. And for the success of our goals, we need both a critical mass of individuals, but just as importantly, we actually need to eliminate all the barriers that prohibit full inclusion of all individuals. We need all of your contributions to accomplish our bold and audacious goals as a campus community. So briefly, and you have the demographics, so I won't spend a lot of time, but just to show you briefly where we are as a campus community. This is a snapshot of 2010 versus 2016, and I wanted to give a few years so you could see that, in fact, we have made progress. The university campus, for our faculty, we are, the percentage of women on our faculty is at 47%, almost at parity, at 50% parity, but we recognize that this is not shared across all academic series or across all professorial ranks in our leadership as well. So we still have work to do there. For the minority faculty, we've seen some gains. While our black faculty remain at 2%, total numbers have gone from 46 to 75. Faculty and Hispanic faculty are up from 83 to 178. So that's significant, as is the increase in the Asian faculty community. Our staff represent the largest portion of our campus community, and they are the most diverse component of our university. And the staff are majority female, they're majority minority, and since 2010, we've seen a slight increase in black African-American staff and a 2% increase in Asian staff. Again, we recognize the fact that this is not carried through all levels of the organization. As we look at leadership and managerial positions, we flip to a majority male, majority white leadership organization on the staff side as well. Our learners represent our future, and they continue as well to be majority female, now at 58% of the total learners. And we've seen increases across all minority groups, except for the American Indians and Alaskan Natives, and that's a particular area of need. So we've been able to work really diligently in our outreach efforts, our recruitment efforts, eliminating barriers at the admissions process and hiring processes to attract more diverse individuals. But in order to sustain and engage, we need to look at what our climate is like and what are the activities we're doing to facilitate a climate of inclusion. We spend a lot of our effort and energy on education and training. It's key for us to have first an understanding of ourselves, of our own biases, our unconscious biases. How do we show up? What are the ways in which we are able to engage with difference and the ways in which it's difficult for us to engage in difference, and how do those things play out? So our unconscious bias initiative has been an ongoing initiative. And then we've focused very heavily over the last 2 years on the elimination of harassment and discrimination. We've been particularly focused on sexual harassment, sexual misconduct elimination, and have introduced online training and required training for all of our students, for our faculty, and for our staff. And we will continue to push these important training opportunities. We, as the Chancellor mentioned, are very proud of the staff certificate program as the largest component of our campus community. Our climate data survey of 2014-13 indicated that, in fact, our staff had some issues relative to feelings of isolation. And so we feel that this is a really important community to do the staff diversity certificate program, to talk about differences and allow people to be comfortable in engaging across differences. And we're excited that the fall cohort will be announcing applications for that very soon. There are other initiatives really across the campus. From departmental levels, most of our campus departments have identified a departmental diversity leader, and we're working with those departmental diversity leaders in quarterly meetings to share best practices across our institution. To our school-based initiatives, the School of Medicine's Differences Matter initiative is a large, grand initiative. All of the schools have been working on curricular engagement and changes, certainly the School of Pharmacy, Dentistry, and Nursing as well. So we have really a matrix of work as everybody is engaged in doing these activities. I wanted to highlight our Chancellor's Committee on Disabilities issue and the Real Abilities Film Festival that we hosted this year as a way to give voice and recognition to the abilities of those individuals who have disabilities. As we move forward, there's some key areas we're going to continue to focus on. Certainly around our inclusion strategies, we have to be ever vigilant. It is we're a microcosm of the country, right, of the world. And so we know that if we don't keep our eye on the prize and keep moving forward and keep being vigilant, that we can actually slip back. So we're going to continue certainly with that work, as well as our bias mitigation strategies. We are going to be launching an initiative with Human Resources and the Office of Diversity and Outreach to look at staff diversity, leadership diversity of our staff community. And the harassment and discrimination piece, I just want to make sure that the campus community is aware of the resources and the activities that we've put in place. We expect to have a campus that is free from harassment and discrimination. Sexual harassment is particularly egregious, and of course sexual assault is unconscionable. This is very serious and very important to us as a campus. We have a care advocate who is careadvocate.ucsf.edu. She's a confidential resource, a place to go if you need help, if you need answers of how to navigate the system, whether you want to report it or not, that's a place to go. So I want to make sure that people are aware of that, as is the Ombuds Office and faculty staff assistants. So there are people there here to help you. I also want to just acknowledge a recent report that I received, that the office has received from our students, and our students have been such leaders in areas of social justice. And the White Coats for Black Lives issued a racial justice report card, and we will be working with them to follow up on the recommendations from that report card. Stay engaged, stand up, learn about what's happening, figure out how to be an ally. Here's some of the activities that are coming up on our campus, and I wanted to let everybody know that the nominations are currently open for the Chancellor's Diversity Awards, so please nominate your colleagues or teams of individuals for that award. So with that, I thank you for your time and attention. For our 10th anniversary, we're so pleased that we were able to get the voices of some of our campus constituents on a video that I want to take a moment to share with you. I just want to thank some of the participants who are here today. You can stand and just wave at the audience. You'll see them on camera. And so we're going to launch into our video.
I'm in Orange, California. Both my father and my mother came from Egypt. This has been a difficult time for me just because of the political environment. Unfortunately, there's been a lot of negative media and a lot of misunderstanding.
I work here at Zuckerberg San Francisco General as a respiratory care practitioner. I've been doing it for 20 years. What I do when I see discrimination or harassment is often I cringe. As a black man, I live it every day. I breathe it. I expect some type of racially charged comment every day of my life.
I was born in Vietnam, and I came to the United States at the age of 11 as a refugee at the end of the Vietnam War. I've always felt like in any setting in the United States, I feel like an outsider, which I actually think is a good thing, because it allows me to see problems and situations with a different point of view.
I founded the Haight-Ashbury Free Clinics when the Summer of Love hit. That was my focus, was you had a stigmatized, discriminated against population, and therefore you were going to deny them health care. If you've ever been discriminated against, it stays with you a lifetime. It brought out that feeling of injustice.
When people experience racism or comments that hurt, having your coworkers stand up for you is a hard thing to do.
I think it's important to speak up and take a stand, not only in my own defense, but for others as well. Injustice can only continue if nobody says anything. Being an active person in combating oppression and just standing up for what's right is crucial.
And so what we want to do is encourage people to speak up. I believe actually that most UCSF faculty, staff, and students do care about these things. They may not know how to talk about it in a way that makes them comfortable or makes other people comfortable, but by not speaking up, actually, that creates a climate that supports the microaggressions.
The university is taking an enormous risk in discussing that difficulty. The diversity training that the university is providing for people to start the dialogue is fantastic.
And there's a much bigger emphasis on diversity now than there was when I was a student and a faculty member.
When I came into UCSF, diversity was something that was appreciated and nurtured here, and I think that impression has only grown through my work at the Multicultural Resource Center, but there is still a lot of work to be done.
It's a wonderful time to be working at UCSF in terms of trying to improve diversity. We are people who aim to cure cancer. So how can you not be optimistic when those are the goals and the people doing the work?
Hi, everybody. I'm Dan Lowenstein. I serve as your Executive Vice Chancellor and Provost, and that's the first time I've seen the video. And I think I'd like to ask Byron and Enga Tung, NG, sorry, and to please stand up. It took a lot of courage to do that. So I also want to express my gratitude, similar to what Sam and Renee have conveyed. It just means a tremendous amount to each of us as individuals to know how much the entire community cares about these issues that are so core to who we are as a public institution, as UCSF. I'm grateful to the leadership that's shown up. There are a lot of our most senior leaders here in the front of the audience. I appreciate the work that Renee, you and your team do each and every day. The breadth and the volume and the extent of the work that you're being called on to do is it's actually unbelievable, and your efforts to make things better are greatly appreciated. And finally, to everybody who's come here today, this is action. This is doing something about something that means a great deal to us to be part of this forum. So I appreciate your being here. So we're now going to shift to a panel, and in thinking about what we would put together for this year's forum, I think the operative word is something that Renee said in her comments, which were the two words, especially now. Especially now. We thought that what many of you would want to hear about are what are the more acute, urgent issues that have come up over the last 6 months or so that have sort of changed the environment, changed the ethos, changed the dynamic of all the various issues that we need to contend with. So we've put together a panel that is really meant to try and provide you some information, some of the answers to the questions that we think you might have about what's going on in the nation now and how it's affecting our institution. So I think we have people in order of, right, Andy, you're going to be starting? Yeah, okay, good. I just wanted to make sure. So I'll be introducing them one by one. We're going to start. I'm going to start with Andy Byman. Andy is a professor in the Department of Medicine based at the Philip R. Lee Institute for Health Policies, and he's served in a variety of federal health policy roles, including as a fellow working in Congress during the passage of the actual Affordable Care Act, and as director of the Agency of Healthcare Research and Quality during the final year of the Obama administration. So obviously we invited Andy here to provide some perspective on what the heck is going on with healthcare in the country. So, Andy.
Thanks very much, Dan, and thank you so much for allowing me to be a part of this really wonderful program. That was an incredible video, and it's really great to be in this community. So just last month, the ACA turned 7 years old, and after a very complicated birth and a challenging childhood, it's shown some real legs in terms of things that it's done in a really positive way. Let's remember, it is now covered more than 20 million Americans who were previously uninsured, the largest reduction in the number of uninsured since the 1960s, when Medicare and Medicaid were introduced as major health policy programs. It's also important to say in the context of today that that expansion of coverage has disproportionately benefited individuals from underrepresented minority groups. It has shrunk but not eliminated the disparity in coverage among minority groups. There were such large differences, particularly for Latino groups and for African American groups. It has made a difference in shrinking that, but not fully eliminated yet. The biggest form of coverage expansion has been through the Medicaid program. And California is really a wonderful example of that, where 3 to 4 million people have gained Medicaid coverage through the ACA. In total, 31 states, including the District of Columbia, have expanded Medicaid as part of the ACA. If the remaining 19 states were to do that expansion, 4 million more people would gain coverage. And of course, that would again disproportionately benefit individuals from underrepresented minority groups, because just 2 of the states alone, Texas and Florida, are about half of that 4 million people who would gain coverage if those states would expand Medicaid coverage. On its 7th birthday, on March 23rd, the Republicans tried to repeal the Affordable Care Act by adding an H to the ACA to make it the AHCA. In my mind, it's fortunate that H remains silent because but it's important to ask ourselves, why is it that the Republicans dislike the ACA so much? I think there are different philosophies in the political parties. Democrats see coverage as a foundational component of social justice, healthcare as a right. And it's also, I think, an important part of seeing that getting everyone under the tent of coverage is a critical step of then being able to do the hard work of cost control, which everyone recognizes as so important. Republicans clearly prioritize a little differently and see coverage as a personal choice, and that the expansion of entitlements is something that they believe the country cannot afford, despite the fact that Medicaid and the subsidies for insurance in the exchanges are a much smaller portion of entitlements, say, as compared to Social Security or Medicare and so forth. So despite the fact that the president said he was going to move on from health care reform if the Republicans could not pass it on March 23rd, we are seeing the attempt to resurrect the zombie of health care reform. And why is that? Well, of course, there were the political promises that were made during the election, but I think there's also a not-so-hidden agenda that we're now being shown as well, which is if the Republicans could reduce the costs related to health care entitlements, that would justify these enormous tax cuts that they're now putting forward that are primarily targeted toward the wealthiest in our country. Can they do it? Well, maybe. They sure have a lot of motivation for some of their paying constituents. Fortunately, they're a little bit stuck because every time they try to move the policy further to the right, they lose the moderates on the left side of their party. And so it has been hard for them to accomplish this goal. They could still try to damage how well the ACA works through regulatory activities or through waivers that are currently allowed under the statute. And we are seeing that they're attempting to use implementation of parts of the law as sort of a hostage. So, for example, we heard in the recent couple of weeks that the Republicans would fund the subsidies in the exchange if the Democrats would be willing to pay for the wall between the United States and Mexico. The Democrats held the line on that, and the president, for now at least, has backed off on that, but he has not committed yet to the subsidies to support insurance through the exchanges. I'll just say that there has been resistance to repealing the ACA. We've benefited from the fact that the administration has been somewhat disorganized in its ability to garner the political will to do this. We're learning about the heterogeneity in the Republican Party, which was less obvious when they were an opposition party. Now we are seeing that the moderate and more extreme wings are having trouble coming together. And finally, I would say that we are seeing, despite the fact, and this is going to be brought up by others on the panel, but that using evidence has mattered. So when the Congressional Budget Office came out with a report at the heat of the moment about repealing the ACA that said 24 million would lose coverage, that was a real body blow against the repeal activities. And so I think it's important for all of us to stand up using science if we want to continue to push social justice through healthcare for all. Thank you very much.
Thanks, Andy. So we'll now turn to Mark Larrick. Everybody knows Mark Larrick. They should. Mark is the CEO of UCSF Health. He's a true veteran of healthcare management. He's one of our nation's leaders. He's the person that people turn to when they want advice on providing health to society. He goes to Washington and provides information directly to leaders there. And Mark, I think the question for you is, given the ongoing uncertainties, how are we dealing as a health system with an uncertain future?
Great, thank you, Dan. And before I jump into that, thank you, Renee and team, for this amazing job you've done today, 10 years of these events. But more importantly, for the culture that we have at UCSF, which starts with the Chancellor and the deans and you, Dan, and others that values everyone who comes here. In fact, I remember when I first started at UCSF, now 17 years ago, we had our annual meeting of the medical staff, and our speaker was Willie Brown, the mayor at that time. And I had indicated that I had just come from UC Irvine in Orange County, and the mayor said, "Mark, we welcome all types here in San Francisco." So I felt at home from the beginning. We're not unaccustomed to facing challenging times. We have financial challenges. In fact, we face them right now. We have operational challenges. We've got too many patients and not enough exam rooms, or all those kinds of issues. We have challenges around our strategy. Where should we be affiliating? What should we be doing? But I always think the hardest, the most difficult challenges to deal with are challenges associated with differences in core values. And I think that's what we're faced with right now. It's a challenge around our core values. Walt Disney's brother, Roy Disney, was famously quoted as saying, "It's not hard to make decisions when you know what your values are." And I appreciate that we have our pride values at UCSF. Do we do a perfect job of executing against those? No. But those are the guiding lights for us in our values, what we hold dear to us. And as I was just thinking about this today, I said, I think we start with, at UCSF in general, I know there's variations, but we start with the philosophy, the value that every human being has the right to accessible, affordable, equitable, available, quality health care. We start with that. That's imbued in everything that we do and how we carry out our work across the VA, Zuckerberg, San Francisco General, here at Parnassus, Mission Bay, every place that we're associated with. And even before the election last year, we had lots of complaints about how well we were executing against that. We weren't happy about how the Medi-Cal program works in California. And as much progress as the Affordable Care Act represented, it wasn't nearly enough. But as Renee said at the beginning, I think the challenge is right now, it feels like we're moving backwards. And I think that's the biggest challenge. This is where our values conflict comes together. The whole issue of block granting Medicaid to California would be devastating. And it would take those 2 or 3 million people, 3 million people in California, who are the people at the fringes, who have finally got coverage, not always getting great care because access is still poor, but we would be taking them off of those rolls, essentially, because it's almost certain that California is not going to make up the shortfall that's going to come from Washington. And I find that deeply, deeply concerning. And I also reject the idea, maybe I'm being too political today, but what the hell, I'm going for it. But I reject the idea that the block granting is done to give states more flexibility. States don't want any flexibility. They want money. They want money to try to provide care to the people that they're responsible for under the Medicaid program in this country. And I find it hard to choke down that the argument is giving states flexibility, but the real goal is to save $1 trillion on Medicaid expansion so we can fund tax cuts or building a wall or whatever else it is. And, you know, maybe tax cuts are the right thing and we could have a different panel on the wall and all the other things. But I will just say, from my standpoint, there is nothing acceptable about taking people who are finally starting to get a foothold in getting health care and taking them off the rolls. I think that's just wrong. So our job at UCSF is to do what we can to make the case. Now, behind me is a poster. This is a poster that we intend to share across all parts of UCSF Health. You have heard President Napolitano make a strong statement, Chancellor Hoglund make a strong statement. Dean King has made strong statements about protecting the civil rights of all members of the UCSF community, including our patients. So what we want to do at a minimum as a first step is to assure our patients that there is safety in our environments here, that we are committed to the values that you see here. We're going to distribute this poster soon. It will be in English, but we will have postcards that are in English, Spanish, Russian, Chinese, and Arabic as well. We got that. Yes, we noted that. We definitely weren't going to leave that out today. And we're also going to arm our staff with talking points about this campaign, including the reassurance that UCSF Health does not and will not share patient information with U.S. Immigration and Customs Enforcement or other federal authorities. That's not who we're about. This message here isn't just specific to patients, though. It's really to all members of our community, and I hope you'll look at it in the context of our commitment to inclusivity. In closing, I've been thinking a lot about the statue that's been erected on Wall Street facing the raging bull of, and the name is the something girl. What is it? I know. My daughter's been telling me about it, so I know these aren't. But it's anyway. It's okay. Let's say the Defiant Girl, and it's this little girl with pigtails and a little dress on, but her arms out at her side, and she's defiant of the bull. And I've been thinking a lot about that because I'm wondering who the bull is and who the little girl is. And for a little while after the first AHCA came out, I was very worried that the bull was the new generation's administration agenda, and that we were the Defiant Girl. But I just start to feel, and I hope with more sessions like this and more discussions like this, that in fact, and I don't want it to mean the Defiant Girl, but the power is going to shift to, in fact, those of us who stand for the virtues of good values, valuing the human rights of everybody who lives in our society, and making sure that everybody gets the health care that they need. And that's where I hope that this leads. So with that, I'll stop. Thank you.
Thanks, Mark. So we'll now turn to Brian Groves. Now, many of you probably don't know Brian Groves. Brian is one of many, but one of our important quiet heroes here at UCSF. Brian is the director of the International Students and Scholars Office, and he deals with everything related to folks who are coming to UCSF from outside the United States, issues on folks who want to go elsewhere in the world, and you can just imagine what his world has been like over the last couple of months. And again, he and his team have been working tirelessly to deal with the consequences of the various executive orders and so forth. So, Brian, if you could give folks an update on where things are.
Thanks, Dan. I appreciate your comments. And I just also want to point out, we have an excellent team. And just after the election, I told the team, I know things are going to change. I know we're going to have lots of challenges, but I can't think of a better group of people than the people we have at the ISSO to go through this. So in some ways, in talking about the challenges, I don't really know where to begin. There's been so many in just a short amount of time. I think the most notable was the January 27th executive order banning citizens of 7 countries from entering the U.S. for a period of 90 days. As you know, the order was extremely poorly written and created massive confusion at borders and airports around the world. Hundreds of visa holders to the United States were denied entry, and at UCSF there were 30 or more community members potentially affected by the order. Very quickly, the federal courts, within a couple weeks, issued a restraining order that halted enforcement of the ban. But then again, in March, the administration issued a more revised, narrow order. The second order suffered the same fate as the first in court and is currently on hold until hearings on May 8th. So it's difficult to predict the outcome of this next hearing, but it's likely the order will remain in litigation beyond May 8th. That's just a synopsis of the executive order, but there are many other challenges. For example, we've seen the unprecedented suspension of temporary H-1B work visa processing that happened in April. The new administration has also broadened the legal standards for removals from the United States for even lawful immigrants with minor legal infractions. Additionally, they've publicly announced their intentions to review all visa types that grant work authorization, and that could affect our international students who are using practical training or other types of work authorization at UCSF. And finally, the Department of State has been tasked to create a more stringent screening for visa applicants. You've heard of extreme vetting. They've been tasked to come up with new ways, additional ways to vet people coming to the U.S. And then you've also probably heard about Customs and Border Protection increasing its search of electronic devices. That's resulted in more denials of entry at the border. So just in summary, in short, this new environment is the most challenging for international students and scholars since 2001. I haven't seen anything like this since 2001. But luckily, I think at UCSF there existed a structure to address any challenges under the new administration. That weekend, after January 27th, our office, the International Students and Scholars Office, had the immediate support of the Chancellor's Office, General Counsel, EVCP, Communications and University Relations, Student Academic Affairs, Grad Division, and HR. Everybody was working that weekend to support our international community. We were able, over that weekend, to send out communications to students and scholars regarding the order and determine that no UCSF student or scholar was outside the U.S. during the order's implementation. By the next Monday, a campus-wide task force was created. It was decided that our office would be the control point for information on the order, and a town hall was presented to address community concerns by Friday of that week. During the same period, the Office of the President supported campuses by establishing a system to utilize their legal services and create a system-wide web resources for immigration issues. And as the circumstances surrounding the order evolved, the Chancellor's task force resolved to remain a standing task force to address any future challenge to the international community. Renee mentioned vigilance, and I think that was precisely the word we hit upon in talking about upcoming communities. There's going to be more and more challenges, and I'm very happy that we have this structure in place. So in comparing UCSF to our peers, I'm extremely grateful to have the support at all levels of the UCSF administration and the Office of the President. I believe it shows the importance we hold for the international community and its critical role to the UCSF missions, and it's the right thing to do. So, thank you.
Thanks, Brian. So we'll now turn to Alejandra Cohen, who is the senior administrative leader of the Office of Diversity and Outreach. And we can't go further without specifically calling out the fact that she essentially made this whole thing happen. So, thank you. So Alejandra is a longtime immigration advocate and the author of Undocumented Immigrants in Higher Education, which is a book that chronicles the historic struggle of undocumented students and their supporters to gain equal access to higher education. So, Alejandra.
Thank you, Dan. Thank you to everyone for being here today. I'll share a few remarks about the work that we're doing here at UCSF to support undocumented students, which we refer to them as dreamers, as they're pursuing their careers here. As an immigrant to this country, as well as a scholar and an activist, I appreciate the opportunity to share a few remarks. And in the interest of time, I would have done it in Spanish, but I think that would have left some people out. So I'll just keep it in English. In the US, there is about 11 million undocumented immigrants. In 2012, the government passed a policy which allows a certain number of them who've come as young people to adjust their status and receive a reprieve from deportation as well as a work permit. You'll see the numbers up on the screen. Across the United States, we have almost 750,000 of students who fall under this policy. California has the vast majority of the students here. The UC system enrolls over 3,700 of them, and we have 12 of them at UCSF in the 4 schools and the graduate division, and we welcome them, and hopefully they're here in the audience as well. During the past 3 years, UCSF began enrolling these young people, and with that, learning about the challenges that they have, as well as the opportunities that we have to make an inclusive community. We have held panels and grand rounds, we have made videos, we have written articles, and we have had conversations about the ongoing lack of access that the vast majority of the undocumented community still has to this day, even in states like California. Just recently, the Office of Diversity and Outreach launched a new website so that we can keep the community informed about everything that is happening. It's been really a furious work and something that we almost do on a daily basis just to keep up with everything that's happening. We're sharing resources, news, events, as well as many of the statements from the leadership petitions. We had over 13,000 people in the UC system sign in support of undocumented students, so we've shared some of that as well. In the past months, given the valid concerns that students and allies have had about the fate of DACA, as well as the increased anti-immigrant discourse and actions, we have reaffirmed our commitment to this important work. One of the most concerning developments on this front has been news from dreamers threatened with deportation. Specifically on March 1st, dreamer Daniela Vargas, an aspiring math teacher in Jackson, Mississippi, was detained and arrested by immigration officials minutes after speaking at a news conference talking about the impact that detention, and deportation have on families. Her brother and her dad had been detained and put on deportation at their home as she was getting ready to go to sleep. Many observers at this point concluded that the detention and the circumstances of her arrest were a clear attempt to intimidate Daniela and to punish her for the exercise of her First Amendment rights. Through the work of many organizations, Daniela was soon released. Daniela's story is an important lesson on the necessary discussions that we need to have about the protection of dreamers and freedom of speech in our community. The debate over immigration will not go away and undoubtedly will continue throughout the UC system. Immigrant advocates should trust that we can permit a civil debate, welcome diverse opinions, and try to win people to our point of view as part of the healthy educational environment in the UC system. Turning our efforts to limit freedom of speech for those we find offensive is self-defeating. We should have greater confidence in our own arguments and not focus on limiting freedom of speech, which is vital to our own efforts. Rather than trying to prevent anti-immigrant provocateurs, like the ones who were trying to speak at Berkeley today, we should take heart at the words of our Chancellor to stand up, speak up, and defend the principles of equity and unity. For Daniela and the dreamers, the 12 dreamers at UCSF, we say, sí se puede. Thank you.
Thanks, Alejandra. So we'll now turn to Claire Brindis. Claire is a professor in the Department of Pediatrics and a health policy expert on adolescent and child health policy and women's health. And one of the reasons that she's here on the panel is that Claire is the epitome of our faculty who are passionate, committed, and want to do something to make things better. And I don't remember exactly when it was, Claire, but I think it was within a week of the election results. You emailed me and essentially said, we need to do something about this. And what we need to do is tap into the expertise that we have here at UCSF as it relates to the life sciences and healthcare, and take advantage of the University of California expertise and provide the information, provide the perspective, provide the facts to make sure that our country stays on track. I forwarded that to Sam. We were both impressed but not surprised that Claire would be coming up with this, because this is what she does. In fact, a piece that she put together as a proposal of how to plan something like this eventually made it to the desk of our president of the University of California. So Claire also was responsible for thinking of and putting together the extremely successful Stand Up for Science forum that took place on Saturday that Sam already referred to. And we've asked her to address the issue of, what is it that we can do as health professionals, as members of the UCSF community, to make our perspective understood and known. Claire.
Well, first of all, thank you very much for those wonderful words. I'm very touched. Like Sam, I've been at UCSF since 1982, and I've been particularly proud of being part of this community. So I want us to spend a couple of minutes related to the Stand Up for Science activities that we were involved in on Saturday, and to do a major shout out to Sam and to Dan for your leadership, because it really takes a lot of courage to stand up at this time and to be visible and to not let things stand, whether there's a bull or a young woman in front of the bull. And I want to quote one person who was part of the panel. I don't have time to go into every single member of the panel, but I'm very, very grateful for who those individuals are. But Esteban Bouchard's statement was, diversity matters for better science. You need diversity in the research, you need diversity in who is being studied, and you need diversity in the people doing the science. Racial and ethnic diversity is science being done right. And I felt that one of the important aspects of our community is that we have a responsibility. We have, as a public institution, the important opportunity to present evidence, to share our wisdom, to share our knowledge, to share our objective research findings that shape and can help shape public policy, as you've heard from all of the wonderful members of this panel. So part of what we attempted to do with this wonderful event at Mission Bay was to have both a stand-up teach-in, which brought together experts from our midst who've had the experience of showing and having their research studies come in conflict with policy, whether it's in the field of needle exchange or adolescents in the military, or the military not dealing effectively with young people, as Dr. Boyer's research, who's here, or the work of Susan Fisher, who's been doing work in basic sciences and have had a lot of conflict around stem cell research. So the panel represented a kaleidoscope of the courage and strength of our community, representing the basic sciences, clinical, translational, and health policy research that goes on every day at UCSF. And when we were selecting with our planning committee the Noah's Ark of who was going to be there, it was not difficult to find these 8 individuals because there are so many more individuals across our campus who could be tapped to share the courage that they have shown and the opportunities that they have taken to bring their research and translate their research to policymakers at the state level, at the local level, the national level, and internationally. So the purpose of that panel was really to share knowledge, to share wisdom, to share insights about how to navigate these very challenging waters. And following following the teach-in, there was a rally with a number of bioindustry partners that UCSF has who were very willing to stand up for diversity and the importance of inclusivity. And the combination of having the teach-in, and I am from an era when we had a lot of teach-ins around the Vietnam War, to have the opportunity to develop that knowledge base and to share the insights and wisdom is particularly important. So the last point I want to make is all of this event, to me, really represented community. Why do we come together at Saturday morning early at 8 o'clock in the morning? Over 200 people came for that. Was because we have to build and nurture each other around the fact that we have the knowledge, the heart, and the courage to be able to stand up, whatever and regardless of what is going to be coming down in the future. And secondly, that we, building on that community, we can learn from each other, we can rely on each other, and we can represent the flag of UCSF as we go out into the world. So I just want to again thank Sam and Dan for your courage for standing up and giving us your vision and giving us your support when we come up with concept of trying to build community and learn from that community. And I want to acknowledge the wonderful panel. They represented individuals from all across our wonderful campuses. And I want to also acknowledge the tremendous work that happened behind the scenes, from social media through the program, through the design. And here is a beautiful t-shirt that represented the science event. So I just want to thank you and this community for standing up and being courageous.
So thank you, Claire, and thank you all. So now the floor is open. This is a forum, and we would encourage those of you who would like to ask questions to the group or have comments. We welcome them.
Dan, can I just mention that the girl's name is the Fearless Girl. Fearless Girl.
Okay.
And we need to be fearless.
There you go. Good. And if you don't mind, please tell us who you are.
Hi. Thank you for your remarks. Michael Reyes, Department of Family and Community Medicine. And I wanted to maybe put Claire a little bit on the spot. A lot of the panel has been talking about some outward forces. And Renee, I really appreciate your remark about very personally feeling threatened in the current environment. And your career, Claire, has just been brilliant. And you're a woman, you're a Latina, you have survived at UCSF. And in this environment, I mean, that's not a small undertaking. In this environment, what advice do you have to the women, or really all of us, about getting through and succeeding here at this institution when we see demographics that don't move as quickly as we would like them to? But you've been a success and you have so much experience. Are there any pearls in there that you'd like to share?
Well, Michael, thank you very much for that thoughtful question. The reality is that we're in this for a long haul. These are problems that have been part of our society for, hundreds of years, and it's not going to be solved overnight. And I think that we have opportunities to educate, opportunities to create collaborations, opportunities to present why we feel strongly about our perspectives, but it also has to be evidence-based. So the reality is creating a sense of community, reaching out to each other, and being patient and persistent and dedicated is really the issue for me. I often think it's not for me an issue of IQ, but it's an issue of I will.
All right.
Yes, please.
Does this work? Okay. Hi, everyone. I'd just like to first thank you for hosting this event. I used to be the inside UCSF alumni, so the Office of Diversity and Outreach definitely means a lot to me. And I'm currently working over at the medical center right now, and I'm also in the midst of applying to medical school. So a lot. Thank you. My understanding of the most recent event that happened right before the March for Science, and Claire, you described it eloquently of what happened, but Dr. Vivek Murthy, who was the former U.S. Surgeon General as of Friday, he had to step down. He had to resign. What piece of advice would you give to our future generation of clinicians, of scientists, of healthcare professionals? Like, what piece of advice would you give for them as they, see this happening and unfolding in their eyes as they embark on their journey to professional and grad school? Thank you.
I'll start, and then I'll ask Andy, who's also recently had the experience of also being, his major responsibilities being taken away from him too prematurely. And we've welcomed him back with open arms, but
Their loss, our gain, right?
But in terms of advice, again, we have to take a longer view and acknowledge that we need to develop the skills. I've been very impressed by the leadership of our graduate division and the Advocacy 101 sessions that they've had for a lot of our students. And there's a skill set in being advocates. And so I think part of it is being empowered within ourselves about what are the skills that we need to bring the information to various policymakers, but in a format that has positive positive traction. We have to, the onus and responsibility about scientific literacy really falls on our shoulders. And I think we need to really take and acknowledge that sometimes we have not communicated as effectively about why our science is so important to both policymakers and to the general public. And to me, one of the outcomes and one of the things I want to continue having dialogue with Dan and Sam about is what's next. Now that we've had this wonderful march, that is not the end of the road. That's just a baby beginning step. So partly is how do we prepare ourselves for the future, and part of it is the skill sets. So Andy, do you want to add?
Sure, yeah.
So tell them sort of what happened.
Oh, well, so as an agency head, I was also given the opportunity to resign. And, one benefit of that is I get to tell you that in a very open way. I'm no longer muzzled by being part of the government. I think it was not just uniquely me. Frankly, the agency heads are sort of cut off across the way. And one thing I would want to tell young people like yourself is, this is part of our democratic system. We have to acknowledge that there are times that the parties shift, different points of view come in. I think this does feel more extreme in some ways and is in fact very kind of jarring for many of us. But when there are times when you feel like there are ways that you can make positive impact on policy, and you feel like you're playing offense. But there are important times too in politics that you need to play defense. And as a close colleague that I got to work in Washington told me recently, defense wins championships. So we need to play good defense right now, and be able to defend the things that are so important, and also to prepare ourselves for future opportunities to be able to continue to make a positive difference. There is the back and forth that is natural as part of our process. I also want to underscore something that I think has been brought out by this panel, but just bears stating numerous times, which is when there's an attack on science, when there's an attack on individuals, there's a sense, people turn inward and feel like, oh, maybe what I'm doing isn't important, and maybe this doesn't matter. And in fact, that plays into the hands of those who are attacking us. And so it's more important than ever to see the value of science and truth. I've been so proud of some of our media outlets, for example, in really pushing back on some of the alternative facts and the lack of truth-telling about certain kinds of policies. And I just want to encourage young people to stay engaged and to realize that it's so important to get the kinds of skills that Claire is referencing, to be able to be informed and to be able to communicate about that, so that in fact we can make the positive changes that we all see as so important. And so we all face challenges along this road. We've got to band together to do that, but we can't just sort of wait passively. Democracy is a very active process. We have to all engage in it. We need to revisit our education that we're offering throughout this country to make sure that people understand democracy, how to be involved, and the importance of science in that process. So I'm so glad to hear you're applying to med school and be part of that, and I really want to make sure that young people do not feel discouraged, but in fact activated to take on what they see as so important to improve the country.
Thank you.
Hi, my name is Fabian Fernandez. I'm a first-year medical student with White Coats for Black Lives. And I just want to thank you all for the amazing work you guys do around diversity. I apologize, I'm new to this community, and so my question is directed at the man in the pink shirt. I'm sorry. not one.
Okay.
That's a quote. And to Dan Lowenstein, if you would like to chime in as well. So you talked a lot about the economic challenges that we face as an institution. And I see a lot of challenges, a lot of cuts being made in our university. I see students of color during Admitted Students Weekend not being able to come here because they don't want to go further into debt and aren't supported financially. I see the New Gen Clinic in the Mission closing down because UCSF claims it cannot have, it doesn't have the resources to support this. And this is a clinic that serves patients of color in the Mission, young teens. I see support staff and IT workers being laid off and their jobs outsourced. And this is all in the context of watching beautiful buildings come up, like the Zuckerberg General, like the Mission Bay campus. And I guess I understand, that economics are nuanced, but I want to understand, how can we put our money where our mouth is at with regards to diversity and continuing to support the amazing programs and people and workers that we have here in San Francisco.
Great question. I'll start and then turn it over to Dan. The biggest single issue that we have is that the financial support for the University of California and for the clinical operations, the medical center, is limited to patient income. In the case of the medical center at UCSF Health, there's no state dollars, there's no money from Sacramento coming in, no money from the university. So it's only margins on patient care that generate our ability to provide services. And what's happened is that the payment rates for Medicare are basically flat. Medi-Cal doesn't cover our costs, covers about half of what it costs. And we have floated this whole institution and all the programs that we have on the back of commercially insured patients. And I told people I feel like my job is more like Robin Hood in Sherwood Forest. We need rich insured people coming through the village, the forest here, so we can take money from them in order to support the other programs that we have. Well, what's happened under the ACA, forget the AHCA, but under the ACA, is that there are fewer people coming through the forest with means. The margins are dropping. Our costs continue to rise, drug costs, labor costs, everything continue to rise. And our responsibility is to run a financially self-supporting institution. And so we find ourselves faced with some very difficult decisions. So for the example, the IT decision that you referenced, this was a service that is not something that we're particularly good at. We thought there was a way to do it at lower cost. Yes, we knew there were lives involved. In every one of those individuals has a story, a family, issues. But on the other hand, we felt that in the grand scheme of things, it was better for us to spend less money on those kind of IT services that could be provided elsewhere at lower cost and have more money to take care of more Medi-Cal patients or provide more services to people who really need the health care. And we're really a healthcare business, we're not an IT business. We tried to do our best to make sure that we treat everyone with respect. We made sure that those employees had many of them got jobs, all of them got plenty of warning time and so forth, and these are IT jobs in Silicon Valley, so there are other options for most of those people. But having said that, it's still a challenge. But I think what you're fundamentally pointing to is the economic reality of healthcare today, is that there isn't as much money to do all the things that we would like to do. And I think our job as a collective community is to decide what are the most important things for us to do. Maybe that clinic in the Mission is on that list, and maybe it isn't. We're going through this in Oakland right now. 70% of the kids that receive their care at UCSF Benioff Children's Hospital, Oakland, are covered by Medi-Cal. Their needs are enormous. Mental health issues are off the charts, and yet there's very little money coming in to support them. So we try to make the judgments according to our values about how to best allocate the dollars, and inevitably it leaves some services short and some people short, and we regret it, we hate it, it's not what we're about, but it's the decisions we have to take. And Dan, maybe you want to talk about buildings and other things. Well, by the way, our donors are so incredibly generous, and what they have done is made it possible for us, in many cases, to continue to provide services that we wouldn't have been able to otherwise. So we're very grateful for that.
Well, I also want to I thank you for bringing the perspective and emphasizing aspects of what is important to you and the students and the community at large, because as you said, you used the word nuanced, and it really is true. I've learned, this is new to me, running a university is a heck of a lot more complicated than I knew until becoming EVCP. And just as one example, as a faculty member and as a student long ago, I used to think $5.2 billion business, the things that we're asking for are rounding errors, right? We use that all the time. It turns out that's not really true when you look at the resources that are actually available for the many, many different needs that we have. And so every single thing that you listed influences one another in terms of making a commitment here to a building or otherwise. And so I think the challenge for us is to do the best we can with your confidence that we are providing enough emphasis across the entire needs of the institution as we can. It's really, really, really hard to do. It's very hard to do. I'm thankful for the $500 million donation that we received from the Diller Foundation a short time ago. We'll begin to see the benefit of that. That's the kind of new resource that will have an impact on a number of the things that you mentioned.
Mm-hmm. Thank you.
Yeah. Yes.
Hi. Excuse me. My name is Daryl. My question is, when I hear the words diversity and inclusion, I often think about, well, what does that really mean to UCSF? Are we really looking at? I hear a lot of different people speak about it, but it's all as if there's different definitions or different meanings to it. And also, how is it that UCSF can really not just focus on diversity alone, but maybe the diversity that exists within the diversity, and not just the easy diversity, but also the hard diversity? I know it's kind of a broad question, but maybe someone can answer that.
You want to? I'm not sure.
And are you referring to sort of intersectionalities and the hard diversity?
Yeah.
Can you say more?
Yeah, like brought into it toward transgender communities and so forth.
You know, as I started off in my comments about our broad definition of diversity, we recognize the need to look very carefully at those really marginalized communities, and we, explicitly have started to work on issues for our transgender community, other groups that don't have a great deal of visibilities, individuals with disabilities, for example. So we are inclusive. As we talk about the demographics where we have numbers, we don't have numbers on all of these groups. So it's hard to sort of show you how we're looking at and tracking individuals, but we're trying to create a climate that lets every individual, however they come to us with their various intersectionalities of their identities, be able to thrive in our environment and be who they are within our environment. I mean, that's ultimately the goal that we seek, and that's how we think about diversity. We have the boxes, but we think about it much more broadly than that.
Thank you.
Mm-hmm.
Oh, sorry, didn't see you.
I'm Sue Forstad. I wanted to raise, first of all, I want to thank everyone for the opportunity. This is a great forum and a great opportunity to raise some of these issues. I wanted to just raise a little bit about the issue of collecting data for the LGBT community at UCSF. So we don't have a lot of that data, and that has come up multiple times. We just don't have the data, but data seems to be what we use to drive some of these initiatives. So I guess I'd like to raise, where might there be some opportunities to look at ways to collect that data, both about the faculty, staff, and students, and how we might start some of that process so we would actually have some data to use to be able to determine where there are some needs, where there are gaps, what really is happening with the transgender community at UCSF, and be able to use that to build and develop some actual initiatives to make some change.
That's a great question, and I think, do you want to also respond to that? I mean, no, go ahead. It's yours.
It's all you, Dr. McGowan.
I agree. There are absolutely opportunities to start to gather that data, and I think in some of the professional schools, they are starting to collect information like that. The most comprehensive data we have to date is around from the climate survey data. And we know from that survey data, 16% of our campus community identify as LGBTQI, and about 0.1% as trans. We had 26 individuals identify in that survey, which was a broadly representative survey, and they identified some unique needs around inclusion, some unique needs around just having some additional visibility. So we have been working with the campus community on LGBT issues, certainly with Clint as the director of the LGBT Resource Center, to make sure that we are giving visibility. We have a visibility project that we're giving education around inclusion that is talking about how these communities are often marginalized or the most marginalized, and thinking about ways in which to educate ourselves about these issues so we all have a better understanding of it, and how can we mitigate our biases, and how can we eliminate our microaggressions and things like that that lead to the isolation that individuals feel. So we're thinking about repeating the climate survey as one of a broad way of getting the data, but avenues for faculty data and staff data we still have to work through, and we can start to work on that with leadership from your committee would be great. Thank you. Thank you.
Hello, everyone. My name is Inji Salama. I am a second-year pharmacy student, and you may have seen my face in that video. It's very honored to be a part of it. First of all, I'd like to congratulate all of you for doing such a wonderful job and speaking so eloquently. So if we could get a round of applause for that. So I actually have two questions, but I'm going to limit it to one in the interest of time. And my focus is on mental health, specifically of the graduate and professional students who are here at UCSF doing amazing things, but also working themselves to the bone. Like, this has been the most challenging week of my life by far. The ceaseless midterms, the endless assignments, and just all of the things that you have to be able to balance in order to succeed. But not just succeed, just to survive here. And you know, I'm very proud and happy that there are resources for student health and counseling, but I feel that it's not enough. I have so many classmates who identify as either bipolar or depressed and have to be put on medication just for the time that they're at UCSF. Like, how hard does it have to be, you know? So my question is, how can we further support students with these mental health struggles, and especially those who come from diverse backgrounds? For example, the immigrant from Yemen or the student who has no family here. So I would appreciate if you could address that question for me. Thank you.
So your observation is not unique to your school or to UCSF. It's a challenge across health professions training everywhere, and I assume actually around the entire world.
Yeah, I just think it's worse here at UCSF.
It's not.
Okay. Okay.
I'm sure of that.
Okay, I believe you.
And I don't mean to be sort of snide about this, but one of the most common things that I share with our medical students, because I'm in the faculty of the School of Medicine, is medical school is really, really, really hard. Mm-hmm. And your training is as well. So you're taking on one of the most enormous challenges that a person can take on, right? Society expects all of us to learn as much as humanly possible, right? As a patient, that's what you expect out of your health profession. And so the school is being charged by society to essentially push us to our limits, to learn as much as we possibly can to help people who are suffering. And that's where the problem is right? We take on this, it's essentially an impossible challenge. Mm-hmm. And finding that place in ourselves where we can feel comfortable that we're going to be ignorant and feel inadequate to some degree is what fuels, I think, almost a universal sense of, you know, I'm not going to be as successful as I want, but it also feeds, of course, issues directly related to mental health. Mm-hmm. And it can ignite an underlying illness or exacerbate one that pre-exists. Mm-hmm. So I want to emphasize you are not alone, and I think we as leadership recognize that this is essentially a universal challenge. Mm-hmm. Take advantage of the support that is provided both within the school and across the campus in terms of student well-being, the health care that's directly provided to you. Network, share your concerns with others, turn to your faculty and other folks that you can rely on. Make sure you're not silent about your suffering. Mm-hmm. If you're not getting the help that you need, you know, speak to the leadership of your school, and I know for certain that every one of them will respond. Sandra, did you want to say something?
I just wanted to add that, you know, President Napolitano has a huge concern and interest in this issue of mental health for students and has committed resources to all the campuses through Student Health Services to have a special initiative around this. So I know that there's never enough resources, but certainly I would hope that you could take advantage of some of that. They have some programs set up specifically for this need. It's very important.
Thank you for your answer.
Sure, so we have time for one last question.
Sorry, I'm a radiology employee, and I've been at UCSF as an employee and a patient for almost 20 years. And I just want to further that comment that she made. I think what we need is training in staff and faculty to appreciate and tolerate diversity, patient concerns, staff concerns, and student concerns, because we need everybody in the leadership, anybody who has any kind of position, to say, yeah, no, I understand that you have a problem today, so if you want to take some time off, just go ahead and do it. The world is not going to stop spinning. That is a big part of this, I think, that is lacking in general. The comment I mainly have is for Mr. Larrick. It's about patient care. It's a comment, it's not a question. As a patient over 20 years, I would really like to do something to make UCSF Benioff hospitals a compassionate environment. I'm talking about patients who come in every day and look at me and start talking to me in Spanish, asking me where they can go. I talk to many patients in the hospital areas where they don't know the directions. And I have seen a situation where a close friend of mine whose relative is in the ICU, and when he was in a really critical situation, the chaplain walked in and she completely freaked out and she ended up in the hospital herself due to an anxiety attack. This is all part of being very conscientious about who the patient is, where they're from, their ethnicity. So I would love to participate in any initiative that you have as a patient and as an employee where there can be more awareness and there can be more compassion, really. I actually sent an email to our Chancellor saying, why can't we just have free parking? I see patients from poor communities, their families trying to find parking for 3 hours in San Francisco, and their kid is in a critical situation. Mm-hmm. I know we're getting a lot of money, so why can't we just carve out X amounts of dollars per year to just say, these 10 spots, have at it. Your family's taken care of. I'm not saying all parking. I will pay for parking, I promise. Take the money from the rich people, quote unquote, and give it to the poor and the kids who are really, really suffering and their families are trying to find parking. This is so simple and so fundamental.
Just first, thank you for those comments. They're right on in so many ways. Just on the last issue, we in fact have a fundraiser every year at the Getty's home to raise money to support simple things like paying for parking and paying for food and for housing for families who come here, because this is an enormously expensive place all the way around. The kinds of things you're talking about from a patient's perspective, we do have a patient advisory council. We'd love to have you get involved with that and provide your input. I'll tell you, there's so much that we still have yet to do, but over the 20 years that you've been here, I hope you've seen there's been a lot of progress. And this was a place that was not always looked at as a great provider of patient care or patient-centric. And now most of our scores put us at the top in San Francisco, better than CPMC and other organizations. Doesn't mean we don't have still a long way to go. But in the end, I believe that is the most important thing, to make this an environment that feels great for patients, they feel cared for, they get the care that they need, and that's what will ensure that we're successful long term. So thank you for your comments.
Oh, Barry, thanks so much for this forum. Thank you very much.
And thank you. And with that, we are at the end of the hour. So I'm very grateful to the panel, especially for everyone who's come here. Thank you.